What if your parents or your grandparents had to choose between paying for groceries or filling a prescription? What happens if they get sick but can't afford to see a doctor? Or imagine this, after a lifetime of hard work, you're finally ready to retire. But now you're on your own when it comes to healthcare. No more employer sponsored health insurance, right? Now you're on a fixed income and you have to try to pay for it all on your own. Think about what would that feel like? What if the very system designed to prevent you from choosing between a roof over your head or the medication you need to stay alive started to disappear? Well, that system is Medicare. It's been around for nearly 60 years. It's changed the lives of millions and millions of Americans for the better. But right now, it's under a lot of pressure financially, politically, ideologically. So, how did we get here, right? What's going on with it? And why does this matter to everybody? It should matter to everybody. Medicare is a federal insurance program that primarily serves people 65 and older, along with some other younger, severely disabled folks. It was signed into law in 1965, and honestly, it was a game changer because before Medicare existed, about half of all seniors had no health insurance. Imagine reaching retirement age and suddenly being on the hook for every hospital visit, every doctor's visit, every medical emergency. Everything had to come out of your pocket. Medicare changed all that. It gave millions of Americans peace of mind, access to care, and the ability to age with dignity. And today, over 65 million people rely on it. And here's the thing, Medicare isn't just some safety net, it's also, a hot topic right now in politics. It's not perfect. There's coverage gaps, rising costs, and growing concerns about its long term future. The program is under constant pressure from both parties. For different reasons, of course. Some want to expand it, others want to cut it. And some are pushing to privatize large portions of it altogether. So, with that, I want to welcome you to Evergreen Perspective. I'm Ben Chrisley. I started this podcast to have honest, grounded conversations about issues shaping our lives, not only just here in the Pacific Northwest, but across the country. A little bit about me, I'm a Navy veteran, a flight nurse with over 20 years of healthcare experience, small business owner, business founder, and a CEO. I'm a running and triathlon coach, youth football coach, an endurance athlete who's competed in ultra trail races up to 200 miles and full Ironman triathlons. I bring all of that lived experience into the work I do, including this podcast. I believe that facts matter. I believe in listening and seeking understanding across different perspectives and cutting through the noise to focus on what's real, what actually affects people, real people, hardworking American people that work every day to provide and to survive. I don't follow a blind ideology just because a political party or a religion says I should. I lead with people in mind, period. That means putting all humans first, regardless of gender, race, sex, age, religion, sexual orientation, identity, or political affiliation. Because if we can start with humanity, we can start actually solving problems. This isn't about left versus right or anything else. So, in this episode, we're going to dive deep. We're going to look at how Medicare came to be, why it was created, and who made it happen. We'll talk about early backlash, how doctors, insurance companies, and Ronald Reagan tried to stop it. A young Ronald Reagan. We're unpacked how Medicare works today, the parts, the private insurance, the gaps, the challenges people face when they fall through these gaps. And then we'll talk about the threats, the budget cuts, the calls to reform or privatize, and who really benefits when those changes happen. And finally, we're going to look ahead. What would it take to keep Medicare strong for the next generation and the generation after that? What reforms could actually help? And what should we be paying attention to as voters in the political arena? Because Medicare isn't about some line item on a federal budget. It's a lifeline for millions of people. And the decisions being made about it affect everybody, whether you're 25, 45, 75. So, let's get into it. But before we do, I want to bring in Kate for Kate's Civic Corner.
Thanks, Ben. Hey, folks. Kate here with the Civic Corner, taking a minute to highlight some opportunities to get involved here in Southwest Washington. If you're not from around here, do a little digging on the internet. I'm sure you'll find some options in your area. We'll put a link in the show notes for each of these opportunities and events where you can find more information, including what to expect and how to sign up. On April 10th at 6:15 p.m., the Indivisible Greater Vancouver Open Meeting will be held at Furstenberg Community Center in Vancouver. On April 12th, we have two events. At 9 a.m., volunteers are needed to help remove ivy from Barron's Woods in Vancouver. And at 11 a.m., the Lewis County Democrats are holding their general meeting. This can be attended both in person and virtually. Again, check the show notes for information on that. And on April 16th, the Yakima County GOP is holding their monthly e-board meeting at 6 p.m. at McCormick Air Center. If there's an event in Southwest Washington that you'd like us to feature here on Evergreen Perspective, please put a note in the comments or send us an email. We'd love to hear about it. This is Kate with Kate's Civic Corner, encouraging you to get out and get involved. Now back to Ben.
Thanks, Kate. So let's rewind the clock to the early 1960s, before Medicare existed, and pause for a second and put ourselves in the mindset of America in the early 1960s. The average life expectancy back then was about 66 years for men and about 73 for women. That might sound shocking today, but back then that was normal. People simply didn't live as long, and there were a lot of reasons for that. Smoking was common, heart disease went untreated, cancer screenings were rare. And for older Americans, especially getting health care wasn't just tough, it was financially out of reach. Private insurance companies didn't want to touch seniors. Too risky, not profitable. So if you were over the age of 65 and you got sick, it could be a game changer. It could be game over for you. A lot of folks just didn't go to the doctor unless it was an emergency. And by then it was often too late. So that lack of access to care helped keep life expectancy low. Medicare wasn't just a healthcare program, it was part of a reality that made people live longer. If you were wealthy, you likely lived longer anyway. Access to private doctors, better nutrition, safer working conditions, it all added up to lead to a longer life for the wealthy. And honestly, not much has changed today. We still see the gap in age difference. The wealthiest Americans still live 10 to 15 years longer than the poorest. Not because they're healthier by default, but because they can afford to stay healthy. They get earlier diagnosis, better treatments, more time, to themselves. They eat better food, have less physical jobs. That's the kind of inequality Medicare was designed to push back against. And it's a reminder that healthcare access still shapes who gets to live longer and who doesn't. Back then, growing old was a gamble, right? If you were lucky, super lucky, you had a pension and some savings, maybe a generous employer who offered health coverage into retirement. Could you imagine that? But for most older Americans, that simply wasn't the case. It was at the time, nearly half of all seniors had no health insurance at all, and private insurance companies didn't want to cover them. Why? We already know why. Because insuring older people, especially those with chronic conditions towards the end of their life, they considered it too risky and too expensive. So if you were over the age of 65 and needed surgery or got seriously ill, you were often left to figure it out on your own. Hospitals require payments up front, right? They wanted your money there. They didn't want it later. And if you didn't have the money to pay for insurance, you weren't going to get it. So if you didn't have that, then what was the problem? Families were forced to drain their savings, or worse, go into major debt. So, many seniors just went without care altogether. They delayed treatments, rationed their medications, and obviously they just skipped seeing the doctor entirely. Not because they didn't want to, but because they simply couldn't afford it. It was a time when the phrase, "don't get old," was said only half jokingly, because growing old often meant growing poor and sick and preparing to die much too young. That was the reality that shaped this movement for change. It wasn't just about politics, it was about dignity, survival, and recognizing that no one should lose their home or their life because they aged into a broken system. And that's where the momentum for Medicare really began. right there at the intersection of having some compassion and being in a crisis. It was an urgent need, because once Medicare kicked in, older Americans started seeing doctors regularly. They started getting surgeries, medications, preventative care, and over time, they started living longer, stronger, better, healthier, happier lives. So, uh, before we go any further, I'd like to take a moment, because I like to put a little part of me into all these episodes. So, um, and not because my story is more important than the facts that we're sharing, but because I believe when we connect on a personal level, these issues hit closer to home. They start to matter a little bit in a different way. So, as I talked about last episode, if you haven't seen it, go check it out. I grew up on a farm where hard work wasn't just a lesson, it was a lifestyle. It was early mornings, long days, and the kind of work ethic that sticks with you for life. And then after high school, I joined the Navy at 17. I turned 18 in boot camp and 21 in the Persian Gulf. I spent 7 years serving this country, and I take a lot of pride in that. But it was during this time, traveling, training, deploying all over the world, that I really started to grow up. I learned responsibility, discipline, and how to take care of the people around me. But just as importantly, I had a chance to work with Americans from everywhere, from cities, small towns, reservations, suburbs, farms like mine, you name it, all walks of life. We came from different backgrounds, different races, religions, different experiences, but we stood shoulder to shoulder. And in getting to know them, I started to see America from a much broader perspective. What I began to understand was that we might have different lives, different viewpoints, but there's a common thread in what we all want. We all want security, opportunity, health, dignity. That belief that we all deserve those things drives a lot of why I'm doing this podcast. And when we talk about Medicare, that belief is at the center of it. Because for a long time in this country, growing old meant being left behind. And the creation of Medicare was about changing that story for all of us, no matter where you come from. So, how do we go from seniors being denied care to Medicare becoming the law of the land? Well, it goes back a ways, right? The idea of a national health insurance had been floating around since President Roosevelt, talking about the New Deal. But it was President Truman who really took the first big step. In 1945, just a few months after World War II ended, Truman sent a message to Congress calling for a national health insurance program. He believed that health care shouldn't be a luxury only for the wealthy, and he wasn't shy about saying so. The opposition was fierce, right? Powerful interest groups like the American Medical Association, for example, slammed his plan as socialized medicine. They launched one of the biggest lobbying campaigns in U.S. history to stop it. And they did, at least for a time, but still Truman kept pushing. He made universal health care a central part of his platform, even when it cost him politically. And while he never got to sign it into law himself, he laid the groundwork for it. So fast forward a couple decades later, enter President Lyndon Johnson. Right, Johnson came into office in the wake of a tragedy, obviously, after the assassination of JFK. But he had a vision for America. He called it the Great Society. It was a sweeping set of reforms aimed at ending poverty and racial injustice. And part of that vision was finally delivering on Truman's dream of health care for seniors. So in 1965, Johnson signed the Medicare Act into law at the Truman Library. It was an historic moment, not just politically, but symbolically. At the signing ceremony, Johnson handed the very first Medicare card to none other than Harry Truman himself, right there beside him. Truman was in his 80s at the time, and he'd lived long enough to see his dream become reality. Man, that's such a cool image, right? Truman receiving that Medicare card, man, it's so powerful because it just showed how progress, even when delayed, is still possible. The will of the people can outlast the power of special interests. We can do special things. So from that moment forward, and launched Medicare, millions of older Americans were finally able to walk into a hospital or a doctor's office knowing that they could get the care that they needed, that they deserved, that they had earned without any risk of everything they had, right? So the rollout, it didn't come without a fight, obviously. It's one of the largest government administered health expansions in U.S. history. And it happened fast. In just 1 year, over 19 million seniors were enrolled. Uh, signing people up was a challenge, obviously, and hospitals had to come up to compliance. Luckily, the Civil Rights Act had just passed 2 years earlier, and Medicare became a powerful enforcement tool because to receive Medicare funds, hospitals had to desegregate. That meant that many hospitals in the South had to finally integrate their facilities, or they wouldn't get paid. So, in a very real way, Medicare became, a good force for racial justice, not just healthcare access. So, win win. There's also initial fears from some doctors and hospitals that government involvement would mean lower payments or bureaucratic red tape. But as time went on and the payments started coming in, those fears started to fade. The system wasn't perfect, obviously. What is? But it worked. And for millions of seniors, it was the first time in their lives that they felt protected when it came to their health. So, yes, Medicare's launch was historic. It was messy. It was ambitious, but deeply necessary, just like a lot of things we do in America. And it laid the groundwork for healthcare debates we're still having today. And I think that's awesome, man. That's way democracy's supposed to work. It's a turning point, not just in healthcare, but in how we as a country choose to care for our own, especially the elderly, right? That worked their entire lives to be able to retire with dignity. So now it's one thing to talk about legislation and president's policy, but the real power of Medicare is in everyday lives. It's touched since 1966. Last year, I transported a guy named Roy. He's a nice guy in his 70s. He spent most of his life doing construction and odd jobs. Nothing fancy. He didn't have any big retirement plan. Definitely no health insurance once he left his workforce. He told me that before Medicare, going to the doctor was always a gamble for him. He said, "You never go unless it's bad." He said, "Real bad, and even then, you hope you don't. They don't want the cash up front." But when he turned 65, he was able to enroll in Medicare. Everything changed for him. He got in to see a doctor regularly, started managing his blood pressure, and even got a knee replacement that he'd been putting off for years because obviously he couldn't afford it. He said that one procedure gave him a whole second lease on life. He said it's not about living longer, it's about being able to live. That's the kind of peace and dignity Medicare is built to provide. And it's a reminder for many Americans, especially those who've worked physical jobs, lived without these safety nets, or just fallen through the cracks. This program is there, it's a lifesaver. But, no government program, especially one this big, ever comes without pushback, obviously. And when Medicare was first introduced, not everyone saw it as a step forward. So let's rewind a little bit back to the mid 60s, 1960s, before Medicare was signed into law. From the very beginning, Medicare faced, fierce opposition. We mentioned one of the biggest ones, the American Medical Association, one of the most powerful lobbying groups at the time. They came out swinging, right? They called it a dangerous step forward into socialized medicine. To them, government involvement in healthcare meant the beginning of the end for private practice and physician autonomy. They even went as far as organizing campaigns to get doctors and citizens to oppose the plan. Kind of sounds like the estate tax. That's a different pod. And they weren't alone. Private insurance companies were thrilled. They weren't thrilled. They weren't thrilled with it, right? Medicare meant that millions of these older adults, even though they didn't really want to insure them anyway, the premiums they were getting, they thought they were going to miss out on those profits, obviously. So, anytime something becomes a threat to, or a perceived threat to somebody's profit, they're willing to put all kinds of money in to stop it. So, it threw their weight behind the anti Medicare messaging, too. But one of the most recognizable voices of the opposition was a young actor turned political spokesman, none other than Ronald Reagan. So, in 1961, Reagan recorded a now famous record called Ronald Reagan Speaks Out Against Socialized Medicine. It was part of a campaign by the AMA to stop the spread of public health care. On the record, Reagan warned that if Medicare passed, we'd wake up one day to find government controlling every aspects of our life, he said. And he quote, this is a quote, Pretty soon, your son won't decide when he's in school where he will go or what he will do for a living. He will wait for the government to tell him. I mean, that was pretty powerful and dramatic stuff back then. And for Americans, it hit home. The fear of big government or losing personal freedoms was a major theme in conservative politics at the time and still rings through today. And Medicare became a kind of lightning rod for that anxiety. Even some hospitals and doctors were hesitant. They worried about paperwork and government audits and losing control how they treated patients. Sounds like private insurance to me. Some even refused to accept Medicare patients in the early years. But here's the twist. Once Medicare actually rolled out in 1966, the people saw the real world impact. Public opinion shifted fast. Seniors were finally getting the care they needed, and people couldn't be happier. Hospitals started getting paid. They were stoked. Doctors realized the sky wasn't falling, and America across all party lines started to see Medicare not as a threat, but as a lifeline. So, over time, the outrage, it faded. What was once called socialized overreach became recognized for what it truly was. It's a promise kept, a commitment to take care of our elders. One of the most effective, widely supported programs the government has ever delivered, right along with Social Security. But the backlash wasn't the end of the story because what you're seeing next is, Medicare has kept evolving. New parts have been added. Private insurers found their way back into the game. And the landscape has started to shift again. So if we fast forward to today and take a look at what Medicare actually looks like now, how it works, where it doesn't, and why millions of seniors still find themselves struggling even with coverage. So what does it actually look like today? Well, it's a patchwork. It's a patchwork like a lot of things. Medicare isn't just one program, it's a set of different parts, each cover different things, and honestly, it's really confusing. So let's try to break it down a little bit. We'll break it down a couple of times here in a couple of different ways so we can all get it. But Part A covers hospital care. So think like inpatient, hospice, skilled nursing. Most people don't pay a premium for Part A. If they worked and paid their taxes, they get it. Part B covers doctor's visits, outpatient care, lab work, preventative services. This part has a monthly premium, and that's based on your adjusted income. Then there's Part D, which covers drug prescriptions. But this isn't run by the government at all. Instead, it's directly administered by private insurance companies that contract with Medicare. You choose a plan, and each one has its own premiums, copays, and a list of covered drugs. And then finally, there's Part C, also known as Medicare Advantage. This is where things start to shift a little bit, get a little bit weird, right? So Medicare Advantage plans are offered by private insurance companies, and they bundle together A, B, and often D. Some even throw in some cool extras that they call dental, vision, gym memberships. Sounds great on paper, but here's the catch: these plans are come with networks, prior authorizations, and surprise denials. In fact, a government report from 2022 found that Medicare Advantage plans were denying care that should have been covered, sometimes for no good reason. So while they may offer lower premiums or extra perks, they also shift a lot of control away from patients and doctors back into the hands of insurance companies. And here's something a lot of people, right? More than half of Medicare enrollees are now on Medicare Advantage plans. So that means that private insurance are playing a bigger role in Medicare than ever before. And it's weird, right? This whole system, the complex maze of deductibles, prior authorizations, surprise bills, and denied care, it's the direct result of private insurance market, right? We ended up here in the first place because they failed the seniors. That's what Medicare was created to fix, and now we're just going right back into that mess. Because before 1965, private insurance companies didn't want to cover older Americans. We know that, right? They considered them too old, too risky. Seniors were getting denied or priced out of care altogether. And so that's why the government stepped in to begin with, not to take over healthcare, but to fill this void that the private market had left wide open. And now here we are, 60 years later, watching the same private market creep back in piece by piece under the argument that government should be in the healthcare business. So let's be honest, that's what got us into that mess, right? We're kind of heading back there again. The belief that the private sector could handle healthcare better has been tested. And when it came to our most vulnerable seniors, people with disabilities, and low incomes Americans, the private market walked away. They failed them. And yet, fiscal conservatives, what are they doing? They continue to argue for less government involvement and more private control, as if history doesn't matter, as if we haven't already seen how that story ends or how that story went. Right? So it becomes this loop, slow erosion, a return to the very conditions that made Medicare necessary in the first place. And the scary part of it is a lot of Americans don't see it happening because it's not happening all at once. It's not just being dismantled, right? It's not just having an executive order to dismantle it. It's happening quietly, gradually, through loopholes and policies and shifts, well packaged marketing. If we're not paying attention, we might look up one day and realize that the public program we built to protect our parents and our grandparents and to help provide for our future is no longer truly public at all, and maybe not even there. Now, on top of all that, many seniors also have to buy something called Medigap. It's a private plan to help cover what traditional Medicare doesn't. Because even with coverage, there are still deductibles and copays that can add up fast, especially for folks on fixed incomes, right? So let's just recap it real quick so we make sure we get it here. Medicare is essential. I think we covered that, but it's not simple, right? It's a mix of public funding, private companies, and a lot of fine print. And for many seniors, especially those living on Social Security alone, the costs are still a major burden. People are skipping meds, right, because they can't afford the copays. They're postponing surgeries because of out-of-pocket cost. And many are navigating this system alone without any help or clear guidance. And if they're getting help or guidance, it's by some of these insurance companies that are guiding them right into a place to be broke. So the big question becomes, why is it this way? Why is a program meant to protect our seniors getting more complicated and more privatized and more expensive for seniors? I was talking recently with Frank. He's a 74-year-old. He's a retired mechanic. He lives just outside of Vancouver here. Been in the same house for over 40 years. He worked his whole life with his hands. He didn't have a pension, much like, a lot of people, just Social Security and a little bit of savings. And, this is a very common situation for a lot of hardworking Americans. He's on traditional Medicare, but between his Part B premiums, his prescription drug plan, and his Medigap policy to cover the stuff that Medicare doesn't, he's spending over $500 a month just to stay insured. That's before any actual medical bills, prescriptions, dental care, which, by the way, Medicare doesn't cover. And here's the thing, he's on a monthly fixed income of $1,800. He said that it's either take care of my health or take care of my bills. Man, I don't know about you, but that hits pretty hard. How many millions of seniors do we have out there in this same situation? Because he's not alone. For millions on fixed incomes, the rising cost tied to Medicare, especially through private plans, are forcing impossible choices once again. And as these expenses creep up year after year, they're hitting the people that are least equipped to deal with them the hardest. So, meanwhile, the private insurance companies are making billions in record breaking profits, right? So, that brings us to the next part of the story, the growing threat to Medicare. Like, where's that coming from? What's motivating it? And who's trying to do it? Frank's story isn't rare, and that should worry us all. Because if Medicare gets more complicated and more expensive, it's also becoming more vulnerable. And not just from rising costs, but from policies and politics that are quietly reshaping it behind the scenes. So, I want to be real clear about this. Medicare is under constant threat. Each year you hear yappity yap politicians, entitlement reform, balancing the budget. Medicare is almost always on the chopping block. Why? Because it's expensive. Of course it is, right? It accounts for about 15% of the federal budget. And some politicians, especially those who call themselves fiscal conservatives, argue that the program needs to be trimmed down, privatized, or made even more efficient. But here's where I stand. I believe it's worth more than 15%. In fact, I believe healthcare should be a basic human right, not something reserved for the wealthy or the lucky. Right now, working class Americans are out there breaking their backs just to stay afloat. We're not asking for handouts. We're not asking for handouts. We're just trying to survive. And for a lot of folks, healthcare isn't even in reach, no matter how many hours you work. That's just not acceptable. It's time the government actually lives up to its promise, the one written right in the Constitution, to promote the general welfare of its people. Not the general welfare of corporations, not the welfare of lobbyists, not the welfare of $1 million handouts to billionaires, but the general welfare of everyday Americans. Programs like Medicare don't drain our nation, they define it. They say, hey, we take care of our own, and that's something worth protecting and strengthening for generations to come. So let's dig a little deeper into why these politicians, particularly those who identify as fiscal conservatives, keep coming back to Medicare when they talk about budget cuts. They say they stand for the people. I don't know what people they're standing for. It's not any people I know. On the surface, their argument sounds reasonable. We're spending too much. Right? The national debt is out of control. We need to rein in government programs to balance the budget. And yes, Medicare is expensive. The federal government spends hundreds of billions of dollars to keep it going. All right, it's one of the biggest single line item on the budget, right alongside Social Security and national defense. But here's the thing: the push to cut or privatize Medicare isn't just about numbers on a spreadsheet. It's about ideology, and a terrible one at that. Fiscal conservatives often believe in limited government, which is fine, but the private sector can't handle healthcare. They've already shown it, right? From their perspective, programs like Medicare represent an overreach of federal power and create some dependency. They argue that private markets are more efficient and more innovative and more accountable. But we already know that this system failed seniors before. The private system failed seniors and those with disabilities before. We already know that. So when you hear phrases like premium support or market-based solutions or voucher systems, what are they really talking about transforming Medicare from a guaranteed benefit into some fixed dollar subsidy? The way seniors can shop for private insurance plans instead of receiving coverage directly from the government. And who benefits from a shift like that? Ask yourself. Well, it's not hard. All you got to do is follow the money. Private insurers, pharmaceutical companies, and large healthcare corporations. The billionaire corporations stand to gain even more billions from a more privatized Medicare model. And those same industries are some of the top contributors to political campaigns, especially on the right. So, how do you think retirees can afford to pay for this extra coverage? The answer is they can't. And going back to a more private system will just leave millions of hardworking Americans that are in their twilight years to suffer. So, yes, the rhetoric is about responsible spending and free markets, but behind the scenes, there's a powerful economic incentive at play. Influence, profits, campaign funding, lots of campaign funding. And while there are some good faith actors in every political camp, we have to ask ourselves, is what's the goal really? What's the goal here? Are they trying to dismantle it? Right? Are they trying to give more $1 billion tax cuts to people? Because for the average American, especially someone living on Social Security, a cut to Medicare isn't just an abstract policy change. It's skipped medications, missed doctor's appointments, delayed surgeries. It's a slow erosion of the safety net that they spent a lifetime paying into. That's important to remember. We spend our lifetimes paying into Medicare so that we can have that safety net when we retire. That's why these debates matter. That's why you have to stay informed, not just what's being said, but who's saying it. These programs matter. The people pushing for cuts of Medicare aren't looking to make Medicare better. They're looking to shrink the program, to decrease people's ability to get health care. And not because the system's failing, it's not, because it's great. Let's talk about something that's glossed over in the Medicare conversation, right? Private insurance, what they're doing in there. Most people hear Medicare and we assume it's a public run program, all by the federal government. And technically it is, sort of, but the reality today is a lot more complicated and a lot more privatized than a lot of people realize. So, traditional Medicare, right, what a lot of people call original Medicare, we've talked about, includes Part A and Part B. That's hospital outpatient coverage and then doctor's visits, right? B has a premium tied to it. But a lot of people don't realize it runs incredibly efficiently, right? The program runs very efficiently. Administrative overhead for traditional Medicare is about 2%. That's it, 2%. So compare that to private insurance companies where their overhead can run 12 to 18%, sometimes higher for some companies. What a difference, right? And why is there such a big difference? Because private insurance, what are they doing? They're being traded on the market, right? So they're marketing programs. They got CEO bonuses and shareholder profits, and right, they're trying to cut the network so they can make more billions. Right? Traditional Medicare, it's straightforward. It was built to serve patients, not generate profits. It's not perfect, but it's proof that when the goal is actual health care, not margins, you can run a massive public program both efficiently and affordably. And yet, despite this efficiency, there's still a push to move more and more people into privatized versions of Medicare, ones that often come with more red tape, less transparency, and higher risk of denied care. So, we've got to ask, if the public version is cheaper, simpler, and works, why are we handing it over to private market? Right? Good question. We know original Medicare doesn't cover everything. There's deductibles and copays. And this is the big one. There's no cap out of pocket spending. That means if you get seriously ill on Medicare, there's no limit on how high those costs are going to come out of your pocket. And it doesn't cover some of the most basic needs for older adults as well, like vision, dental, hearing, long term care. So think about that. You can be 75 years old, living on Social Security, and you're on your own when it comes to your teeth, your glasses, and your hearing aid. So, how did we get here? Well, it wasn't by accident, that's for sure. Right? Medicare was created, it was designed as a compromise because it had so much pushback. We haven't done a much better job of moving it forward at all. So, it was a way to get something passed without fully nationalizing healthcare. Certain services were left out, right? Partly to keep costs down, but mostly because it had heavy resistance from private insurance companies and conservative lawmakers who didn't want government run healthcare expanding too far. God forbid we get more people with healthcare coverage. But over time, rather than fill those gaps through public coverage, the system just started leaning more and more on private market. That's how we ended up with Medigap plans, private supplemental insurance, right? That's how we got here. And who sells those plans? That's a great question. Great question. Private insurance companies do, of course. So once again, we're seeing public dollars flow into private hands. Not because that's what works best, but because that is what politically acceptable. And we've been building on that patchwork ever since. So let's talk a little more about the Part D. It's the prescription drug plan. Right? It wasn't they didn't even think about covering people's prescriptions. I don't think they anticipated how expensive medications were going to get. So in 1965, no prescription drug coverage. So at the time, major opposition to it, mainly coming from the pharmaceutical industry. Imagine that. They didn't want the federal government being able to negotiate drug prices or interfering with their profits. So the compromise was just keep the A and the B, Part A and B, and if you needed medications, you're just on your own, right? Or maybe you got some help through state, or if you're a veteran, maybe you got some help there. But Medicare didn't want to touch it. But in 2003, under President George W. Bush, Medicare D was created through the Medicare Modernization Act. It was a big deal. Finally, seniors could get some help paying for prescriptions. But once again, it came with a catch, right? It wasn't coming from the government, it was completely privatized. So the law prohibited the government from negotiating drug prices directly and instead handed it all over to private insurance companies and pharmaceutical companies. So today, if you want prescription coverage, you have to shop for a private plan. So then you have to compare the formularies, make sure it has the medications that you need. You have to check the pharmacy networks, make sure a pharmacy that's in your area is a member. And you got to juggle premiums and deductibles and hope that the meds you need are actually going to be covered and affordable. So, once again, we're watching public money flow to private companies because that's how they've paid off politicians to get to vote for it. So not because it works best for patients, because it worked best for the people writing the checks. So then we'll talk about the big one. This is the big one, guys. It's Part C, also known as Medicare Advantage. This is where private insurance companies have made the biggest move and big time profits. Medicare Advantage allows private companies like United Health, Humana, Aetna, and others to offer an all in one alternative to original Medicare. These plans include bundle everything together: hospital, doctor, drug coverage into one single plan. And it sounds good, right? They even offer some dental and vision, and man, that sounds awesome. But the problem is, Medicare Advantage plans are still private insurance, and they come with all the usual baggage. So we're talking about narrow networks. You can only see certain doctors. We're talking about prior authorization. Your doctor might say you need a test, but the insurer says, no, no, thank you. We're talking about those denials of care, even for services that would normally be covered under original Medicare. They're just denying them. What? And most importantly, we're talking about profit incentives because Medicare Advantage plans are paid by the federal government to cover you, but the insurance company make more money the less care they use. That's the business model. So if you enroll in Medicare Advantage plan, you're still part of Medicare, but your coverage is now handled by a private insurance company, not the government directly. So how does that work? The federal government pays the insurance company a set amount of money every month to take care of you. So think of it like this: Medicare says, hey, here's a flat fee for Frank. You're now responsible for all his hospital care, doctor's visits, prescriptions, the whole deal. Now, here's where the profit incentive kicks in. The insurance company gets that money whether Frank uses a lot of care or not. So if Frank goes to the doctor a bunch, needs expensive tests, or has a surgery, that cuts into the company's profit. But if Frank doesn't use much care, if he avoids doctors and skips specialists or gets denied a test, that they say he doesn't need, then the insurance company gets to keep that profit. It's kind of like one of those monthly car wash memberships. You pay a flat fee, right, every month for unlimited washes, but the company's banking on the fact that you won't go that often. That's how they make money. So now imagine you show up for your third car wash of the week, and suddenly they're like, oh, so sorry, we're doing maintenance today. Or, oh, you have to wait 72 hours between washes. Or they hit you with some rule buried in the fine print to delay or deny your wash altogether. They're still collecting your money every month, but now you're getting less service while they keep more profit. That's exactly how Medicare Advantage works. The government pays these insurance companies a set amount of money each month to take care of you. And if you use less care, right, you have less doctor's visits, procedures, or prescriptions, the more money they get to keep. And if they can delay or deny certain services, that's even more. That's even better bonus for them. So, behind all that slick marketing and these extra perks, there's a business model that rewards not taking care of you. That's the part they don't put in the brochure, right? That's why these companies put in things like prior authorizations. We know that's when your doctor recommends something, but the insurance company says, hold on, we got to approve it first. So they might delay it, they might deny it, they might ask for extra paperwork. But every time they say no or they drag their feet, that's money they don't have to spend. That's how they make money, by betting that you won't get much care. And the scariest part, that system often puts profit ahead of patients, obviously. So while these plans advertise the bells and the whistles, free gym membership, dental coverage, zero premiums, the fine print can mean less access, a lot more red tape, and delayed or denied care. And that's the trade off. And it's something every senior and every caregiver needs to understand before signing up for these programs. A recent investigation by government watchdogs and journalists have found widespread abuse. Right? Companies exaggerating how sick patients are to get higher payments from Medicare, denying necessary treatments, or using algorithm based tools to shorten stays or determine people's care. These aren't rare cases, they're happening frequently. And here's what's wild: Medicare Advantage is growing fast. In 2007, it's about 19% of Medicare beneficiaries were enrolled in these private plans. Today, it's over 50%. That means that a majority of people on Medicare are already in a privatized version of the program. And a lot of people don't even realize that. So, I mean, why is it growing so fast? Well, for one, these plans, they're heavily advertised. Especially to older Americans in the TV they watch. You've probably seen the commercials. Get more benefits, no premiums, call now. Talk to an agent is standing by to rip you off. Oh, they don't add that part in. And two, the government actually pays more per enrollee for Medicare Advantage than it does for traditional Medicare. How about that? Not much of a sweet deal for taxpayers, right? So not every, some work well for people. Some plans do work well, but what's important to understand is that the structure of the system is changing, right? Quietly, steadily, but profitably for the private insurance companies. And if we keep going down this path, are we still protecting the public good, or are we handing it over to the private corporations that had already failed this group of people already once? That's why the role of private insurance in Medicare isn't just a policy detail, it's a warning sign. Because the more we let private interests shape public programs, the more we have to ask, who is the system really working for? The Medicare Advantage, for example, these private plans are now enrolling over half of the Medicare recipients. We know that. They get billions of taxpayer dollars to do it. These insurance companies are turning a tidy profit while denying care, shrinking networks, and pushing costs back onto seniors. Right? Meanwhile, lobbyists and special interest groups are hard at work in Washington advocating for more privatization, not less. And why are they doing this? Because the more Medicare gets handed over to private insurance, the more revenue they can bring in, right? The more billions they can bring in. And if you're wondering whether any of this makes a difference in elections, it absolutely does, right? Campaigns contributions from insurance and pharmaceutical industries run deep. And they're not donating out of the kindness of their hearts. They're investing in influence. So know where your candidates are getting their money. Look it up. Open secrets. See where they're getting their money from. All right, there's another threat: the slow erosion of public trust. Confusing policies, hidden cost. All right, these wear people down. They make folks question whether Medicare is still working for them because so much of it's private. And once people stop believing in a system, it becomes easier to dismantle it. So, we all need to be asking, who benefits when Medicare gets cut, privatized, or chipped away at? It's not Frank. It's not a 68-year-old widow trying to afford insulin. It's not that rural family taking care of their aging parents. It's the billion-dollar corporations. It's the lobbyists. It's the politicians who are getting those campaign kick-ins that treat healthcare like a business opportunity instead of what it is, a human right, a public good. That's the real threat, and it's happening in plain sight. Right? But, let's say it's not all gloom and doom. There are leaders, organizations, and movements fighting to protect and improve Medicare. If you care about Medicare, those are the politicians you need to vote for. Right? So let's talk about the road ahead a little bit. Some fixes, maybe some things it might take to make the program stronger. We've talked about the origins of Medicare, talked about the backlash, the growing role of private insurance, the creeping threats that could unravel everything in this program. But this isn't just a story about what's gone wrong. It's also about what we can still do, what we can still do right. So, for starters, Medicare isn't going bankrupt like some headlines love to scream. But it is facing real financial pressure. The Hospital Insurance Trust Fund, which pays for Medicaid Part A, is projected to run short of funds by 2030s, early 2030s. That's if nothing changes. We still got time. That doesn't mean Medicare would disappear. It just means Congress needs to do something to act to make this shortfall up. So there are a few proven ways to shore this up. Right? We need to start allowing Medicare to negotiate drug prices. And we did have that until recently. We had it under the Inflation Reduction Act, and it was a huge deal because the U.S. pays more for prescription drugs than any other country. And this gave Medicare bargaining power. Man, it was going to save Americans billions of dollars. It was. But in January 2025, when Trump signed an executive order reversing initiatives aimed at reducing prescription drug costs, so this move effectively halted the ability to negotiate lower drug prices with the pharmaceutical companies. So the reversal means that Medicare no longer has the bargaining power to negotiate. So it's going to lead back to the higher cost for the program and its beneficiaries. And, honestly, it's just going to hinder efforts to make medications more affordable. And that's a shame. It really is, because we had a chance. So, very disappointed in that. Something else we can do is close tax loopholes for the ultra wealthy. You guys heard me say it before. It needs to happen. Right now, some of the wealthiest Americans, multimillionaires and billionaires, pay a lower effective tax rate than you or I. Let that sink in. Teacher, nurse, welder, people working full-time jobs, paying payroll taxes every paycheck end up contributing more proportionally than a hedge fund manager making millions off investments. Guys, we gotta stop taking up. They just gotta pay their share. I'm not asking them to pay more percentage. Will their number be bigger? Sure, and it should be. They make a lot more. All right. Meanwhile, we're told we can't afford. We can't afford it. Can't afford to keep Medicare strong. I don't buy that. We have the money. What we lack is political will. We lack politicians with backbones. Right? We need a fairness in our tax system. Moderate increases in taxes for the ultra wealthy and large corporations, not on working people, not on small business owners, but on those super wealthy people. It could stabilize Medicare for decades, no problem. We're not talking about a punishment. We're talking about return to basic responsibility. Because when billion-dollar corporations in the top 1% don't pay their fair share, that burden falls on us. Falls on working families, on seniors, on people who cannot afford to carry any more weight. Medicare is built on a promise that we take care of our own. That after a lifetime of work, you don't have to be left behind. And if we let that promise erode while the richest among us keep hoarding wealth and dodging taxes, that's not a budget problem, it's a moral failure. Let's be honest, it's about a class warfare. But not the kind where working people are attacking the wealthy. Nope. It's the other way around. And it's been going on for decades. The ultra rich, billion-dollar corporations and their lobbyists have rigged the system in their favor, dodging taxes, writing the rules, and gutting public programs that everyday Americans rely on. So, yeah, this is about class warfare. But it's not about resentment. It's not. It's about balance, fairness, and accountability. It's about economic justice and reclaiming a system that's supposed to work for everyone, not just a few at the top. Because if we don't call it what it is, we can't fight for what it's worth. It's about priorities. And it's time. It's time we start standing up for the folks who built this country with their hands and their time and their sacrifice, not the ones cashing in on their labor. We need to expand Medicaid coverage to include dental, vision, and hearing. Now, for some, that might sound counterintuitive. We're worried about cost and we want to expand. But the truth is, covering these essential services for our elderly up front reduces very, very expensive emergency care down the road. It's preventative care, and it saves money and it saves lives. We got to stop overpayments to private Medicare Advantage plans. Why are we paying them more than what we pay out when we manage it on our own? These plans are currently being paid more than traditional Medicare to do the same job. And to be honest, doing the job worse. They need to level the playing field, redirect those billions back into the public side of Medicare. But here's the truth is, none of this happens if we don't stand up and fight. Because standing in the way of these reforms are some of the most powerful industries in America. Insurance companies, pharmaceutical giants, and the politicians who are getting big money donations from both of those. That's why the future of Medicare is a political question, not just a policy one. And that brings us to this moment right now. Across the country, voters are being told that we need to tighten our belts or make hard choices. But too often, those choices only ever seem to fall on seniors, hardworking families, and people who are just trying to stay afloat. And when you hear politicians talk about entitlement reform or modernizing Medicare, it's important to ask, who's being protected and who's being asked to sacrifice again? Because this isn't just about money, it's about values. Do we believe that healthcare is a right in old age or at any time? I believe it's a right for everybody. Or do you just think it's another bill that you have to figure out how to pay it and you don't deserve healthcare? I don't agree with that. Do you want a future where your ability to age with dignity depends on your income or your insurance network? Or do we want to build on what Medicare started and finally create a system that pits people over profits? Is Medicare perfect? No. No, it's not. It's been shaped by a large compromise, being chipped away at by corporate influence and used as bargaining chips in political games. We know that. But at its core, Medicare represents something bigger than government program. It represents a promise and a commitment that we're going to take care of each other. We're going to take care of our most vulnerable. That after a lifetime of work, you won't be left behind. That your ability to live with dignity doesn't disappear when your paycheck does. And right now, that promise is under threat. Not because it doesn't work, but because it does. Because it reminds us that when we pool our resources, when we care for one another, when we choose people over profits, we all do better. So let's stop pretending we can't afford it. Let's stop asking seniors to sacrifice while billionaires hoard wealth and corporations dodge taxes. They need to pay their fair share. Let's stop letting the same people who broke the system tell us we can't fix it. We can. Healthcare is not a luxury. It's not a privilege. It's a human right. And Medicare, that's just the start. Time to protect it, strengthen it, and build a future where every American, not just the wealthy, not just the lucky, can count on care when they need it the most. Thank you for listening. I want you to stay informed, stay engaged. And as always, lead with people, lead with humans first. Thank you so much. This has been Chris Lee with Evergreen Perspective. See you next time. Reminding you to take care of yourself and take care of each other. Till next time.